My name is Shayan, and my project is about thoracentesis. This is a medical procedure that removes fluid from the pleural space, which is the area between the lungs and the chest wall. When there's too much fluid in this space, it can make it hard to breathe. Now, on the left side of my board, under conditions, I listed the main causes of this fluid buildup. These include congestive heart failure, pneumonia, TB, lung infections, and lung cancer. In the why and when section, I explained that doctors do this procedure when a patient has chest pain, trouble breathing, or a chest x-ray that shows fluid in the lungs. In the center of my board, you'll see a diagram showing the lungs and the pleural space. That's where the fluid collects and where the needle goes during the procedure. In the green preparation section, I explain that patients sit up and lean forward. The doctor cleans the skin and uses a freezing medicine to numb the area. Now, please enjoy this video about the procedure of thoracentesis.
Thoracentesis, or pleural tap, is a procedure in which a doctor takes out fluid that has built up inside your lungs. Here's a quick step-by-step guide on how this procedure is done. First, your doctor will explain the procedure and answer any questions to ensure you're comfortable. After you're ready, you'll be seated in an upright, slightly forward-leaning position. Next, the doctor begins the procedure by cleaning the area with a sterile solution. Using ultrasound guidance, the doctor pinpoints the exact area to target, minimizing risk and increasing accuracy. To make sure you're comfortable, a local anesthetic is applied, so you shouldn't feel any pain during the procedure. Next, a small flexible tube called a cannula is inserted into the chest cavity. Through this tube, a sample of fluid is collected for lab analysis, helping to determine the cause of the fluid buildup and providing vital information for your treatment plan. Then, a bottle is connected to the cannula, allowing the doctor to safely remove the excess fluid from around your lungs, gradually relieving the pressure. Later, a doctor carefully removes the cannula from the insertion site and the area is thoroughly cleaned to prevent any chance of infection. Finally, a sterile bandage is placed.
In addition to preparation, doctors recommend no solid food between 2 to 6 hours before the surgery. Also, you must inform your doctor of any allergies in advance before you get the surgery done. Now, let's take a look at a step-by-step process for this procedure. Number 1. Patient sits upright on the edge of the bed or chair. Number 2. The skin on the back is cleaned and numbed. Number 3. A thin needle is inserted into the pleural space. Number 4. Fluid is slowly drawn out using a syringe or tube. Number 5. The fluid is collected in bottles for testing. Number 6. Once done, the needle is removed and a bandage is placed. It usually takes about 15 to 30 minutes. In the purple step-by-step section, I explain how the doctor inserts a needle between the ribs and gently removes the fluid using a syringe or vacuum bottle. Afterward, the area is bandaged. On the lower left, in the orange tools section, I show the equipment used: a needle, ultrasound machine, syringe, and chest x-ray. On the right side, in the pink and yellow, I explain patient recovery. Nurses check the patient, and most people feel better quickly. A chest x-ray may be done to make sure there are no problems. Finally, at the bottom, I included my references using an APA format. Thoracentesis is a safe and useful procedure that helps doctors and the cause of lung problems and help patients breathe better. Thank you for listening.